Suicide Awareness Month, and I wanted to start this month off by making a crucial video to discuss a topic that we often see as taboo or scary. So I'm going to offer a trigger warning before you watch this video, as it discusses topics and situations that might be triggering to some people. So please proceed with caution. In this video, we're going to discuss many questions you might have about suicide, like what are suicidal ideations? What's the difference between an intrusive suicidal thought versus being suicidal? When should I seek help from suicidal thoughts? Will I be hospitalized if I tell my therapist about my suicidal thoughts? How do I go about telling someone about my thoughts? How do I support a suicidal friend or a loved one? And finally, how can I help myself? Hi, my name is Micheline Maalouf, and I'm a licensed mental health counselor. If you haven't subscribed to my channel yet, please do so. I make weekly videos to discuss mental health topics and give you actionable tools to take charge of your mental health. I want to start this video off by saying that talking about suicide does not encourage or motivate people to take their lives. Instead, talking about suicide helps people understand themselves better and learn that they're not alone. It helps them process their thoughts and their feelings and can result in a release of intense emotions that lead to suicidal thoughts in the first place. Suicide does not have a look. It does not have a face or a mood, and it doesn't discriminate based on health, success, relationship status, or otherwise. It's not uncommon to hear someone say that they had no idea that their loved one was struggling that much, or to hear that nobody would have known they were hurting. Just think of famous people who have died by suicide, like Robin Williams, Kate Spade, and Anthony Bourdain. People would deem them successful, joyful, and even lucky. Those close to them may have noticed some struggles, but not to the point of taking their own lives. One of my favorite social researchers and authors, Brené Brown, said something that stuck with me. She said, "To say that suicide is selfish is not only wrong, it's ironically and sadly incredibly self-protective. It's as if you're raising your hand and saying, although I didn't know you, and I clearly do not understand clinical depression and suicide, I'm going to continue judging people who die from it, even if it causes unimaginable pain and trauma to the survivors, and further stigmatizes mental illness because it makes me feel better and safer and more comfortable. To know pain is human. To need is human. And no amount of money, influence, resources, or sheer determination will change our physical, emotional, and spiritual dependence on others. Many of us are willing to extend the helping hand, but we are very reluctant to reach out for help when we need it ourselves. It's as if we've divided the world into those who offer help and those who need help. And the truth is that we are both. Need is the most beautiful compact between humans." Take a moment to reflect on this powerful quote. Let it sink in and really think about the words that she said. So let's get back into suicide and answering the questions I mentioned at the beginning of this video. What are suicidal ideations? Suicidal ideations are suicidal thoughts. These thoughts can come frequently or occasionally. They can be severe and all-consuming to less intense and fleeting. There are two types of suicidal thoughts. There are passive suicidal ideations and active suicidal ideations. With passive suicidal ideation, you might experience thoughts about suicide, but you have no plan or intent to carry them out. Passive suicidal ideations are common among those who live with depression and anxiety. They may think and feel that life is too hard to live, but don't actually have a plan and don't want to carry out the plan. Unfortunately, passive suicidal ideation can seem so normal to people that they don't even recognize it's an issue. Here are some examples of passive suicidal thoughts. I don't feel like living anymore. I hope someone runs into me on the road and kills me. Maybe I'll get a terminal illness and die quickly. People would be better off without me. I wish I could just die in my sleep. I wish I could just die. These thoughts can make us upset or sad, or they may result from feeling down or going through a significant life event or loss, or from living for years with a chronic physical or mental health condition like chronic pain or depression. Many people don't address passive suicidal ideation because they don't see them as severe enough, or they have fears that someone will see them as crazy and institutionalize them. I'll go over the importance of talking to someone about suicidal thoughts later, even if it's the passive kind. With active suicidal ideation, you have had thoughts of suicide and are developing or have developed a plan to carry it out. You might fantasize about doing it and get a sense of relief about the thought of ending your life and ending your pain. Here are some signs that you or someone you love is actively suicidal. They may start to talk a lot about death, dying, or not being around in the future. They might withdraw socially. They start giving away possessions. They stop going to work or engaging in their social activities or the things that used to bring them joy. They begin making amends and start talking as if they're saying goodbye. They increase harmful or risky behaviors like drugs, alcohol, or self-harm. Whether passive or active, we should always take suicidal thoughts seriously. You will not encourage a passively suicidal person to become actively suicidal by talking to them about suicide. On the contrary, you are more likely to help save someone's life by speaking to them about suicide and offering them support if they are actively suicidal. Most suicidal people don't want to die, but they see it as the only option to stop the pain. They feel helpless and like there is nothing left to get them through. When talking about these thoughts, it can help them experience a sense of relief. It can help them feel seen and heard, and most of the time, it actually helps them diffuse these thoughts and no longer carry out this plan. I'm going to talk later about how you can further support someone who is suicidal. But for right now, I want to address the next question. So what's the difference between intrusive suicidal thoughts versus being suicidal? Intrusive thoughts about suicide are different because intrusive suicidal thoughts are seen as scary and unwanted, not as an option for relief or a means to an end, but rather as the fear of losing control and committing suicide. Usually these thoughts are ego dystonic, meaning they go against what we want. They are fear-based thoughts of doing something we don't want to do, rather than thoughts about something we wish would happen. The person experiencing intrusive thoughts about harm or dying may be repulsed at the suicidal thoughts, be fearful, question themselves as to why they're having these thoughts, and they fear themselves carrying it out. A person that is passively or actively suicidal will not see these thoughts as fearful, but instead as an option and maybe even comforting, that an opportunity to end it all is possible. Intrusive thoughts about suicide are common among those who struggle with obsessive-compulsive disorder. We will discuss this in future videos, but for now, let's return to suicide. When should I seek help from suicidal thoughts? The answer to this is as soon as possible. Even if your suicidal thoughts are passive or intrusive and you don't want to carry them out, they indicate something happening underneath the surface. Regardless of the reason for the suicidal thoughts, getting help and support is always a good idea and can prevent you from getting worse. If you don't have access to mental health care, please check the links in the description below to see where you can get reduced price or therapy for free or free resources. One of the most common questions I get about suicide is, will I be hospitalized if I tell my therapist about my suicidal thoughts? The answer to this should be no, but I can't say with confidence about every therapist or professional you encounter. The correct thing for your therapist to do is to assess your risk. They do this through something called a risk assessment. A risk assessment determines if your thoughts are passive or active, or whether or not you might carry out the plan to harm yourself. If they are passive suicidal thoughts, the therapist should help you discuss the thoughts and discuss any fears you have around them. Good therapists understand that suicidal ideation is a part of many mental health challenges and know not to hospitalize you immediately. Ideally, they will communicate with you about them. They will communicate to you about them regularly. They'll create a safety plan with you and help you build coping skills and process the emotions, feelings, and/or trauma that has caused you to develop these thoughts in the first place. Unfortunately, this is not always the case. I have heard of many instances where a therapist or another professional has immediately jumped to hospitalization without proper assessment or communication. The truth is, even when someone is actively suicidal, hospitalization is not always necessary. This is because there are so many different options, and hospitalization should be the very last resort. But of course, having said that, there are times when hospitalization is absolutely necessary. Hospitalization should be only an option when there is nothing that the suicidal person is willing to do or try, and it seems like the individual will follow through with the intent to harm themselves. I will make future videos about knowing where your therapist stands on this matter and how to find out how they handle suicidality and suicidal thoughts. So make sure that you subscribe to my channel so you don't miss out on that video. The next question I'm going to address is, how do you go about telling someone about your suicidal thoughts? Telling someone about suicidal thoughts is not easy, but it is a significant step, and it is such a helpful step to keep you safe. It can also be beneficial to diffuse the thoughts and get you to feel slightly better. You want to make sure that you're telling a safe person that has earned the right to your trust, and you know that they will be empathetic and non-judgmental. If you have that kind of person in your life, you are extremely lucky. So take advantage of that support. You first want to tell them that you want to talk to them about something serious regarding your mental health and that you would like to meet with them. Then it's helpful to set up a time to meet, a time when both of you are free of distractions and both of you have agreed upon this time. And then before you get into anything, let them know your needs and expectations. Do you want them to just listen and be an empathetic ear? Do you want them to give you advice? Do you need them to help you find a therapist? Know what your needs are and let them know. It can sound something like this. Hey, I've been struggling with my mental health recently, and I want to talk to you because you're my safe person. But before I get into anything, I need you to just listen. I don't want advice, and I don't need you to freak out. I might ask for advice later, but please just listen until I specifically ask you. Is that something you can do? If they say yes, then go forward and talk to them. If after you're talking to them and they're listening, you find yourself actually wanting support or advice or kind of shifting in what your needs and expectations are, don't be afraid to let them know. Don't be afraid to say something like, I know I said I didn't want advice or help earlier, but I actually do want it now. Or, can you help me find professional help, please? Having a safe group of people, loved ones, or people that you can lean on has been shown to reduce risk and help people that are actively suicidal become less suicidal and feel better. So if you have a friend that's suicidal, how do you support them? How do you support a friend or a loved one that's suicidal? If a loved one comes to you and discloses that they're suicidal, here are some ways that you can help. Number 1, be empathetic. Don't freak out. I know it's easier said than done, but remind yourself that they are telling you because they trust you. Remind yourself that talking about suicide helps significantly reduce the risk. You're not encouraging them to follow through by talking about it and asking questions. Number 2, talk about it. Ask questions. Ask them if they are passive or active thoughts. Ask them if they have a plan and a means. And ask them if you can offer support by helping them find and get professional help. Number 3, create a safety plan with them. I've created a free safety plan that you can access from my website. I will link it below in the description box. This safety plan will help them recognize warning signs, write down coping skills, and have a step-by-step guide on what to do in case they become suicidal. The next step is to make sure that you're constantly checking in on them. Let them know you care. Let them know you'll always be there to be a listening ear. Text them every once in a while. And don't be afraid to continue to bring up the suicidal thoughts. And the final step on helping a loved one is do your research. Learn about suicidal ideation. If you're watching this video for a loved one, you're already on the right track. Find out how to support that loved one through various resources. There are tons of tools online and resources and websites and phone numbers that are free, and you can share them with your friend, your loved one, or for yourself to get support while supporting somebody else. And again, I do have a ton of resources linked in the description below, so make sure to check that out. The final question is, how do I help myself if I'm the one experiencing suicidal ideation or suicidal thoughts? If you've had suicidal thoughts, please don't ignore them, even if they seem minor and passive. Instead, talk to someone about it and get the support and the help that you need to address the underlying issues. Here are a few steps that you can take to help yourself. Number 1, identify safe people that you can talk to and let them know and ask them to support you in whatever way you need. Whether that's to help you find professional support or just to have someone check in on you and be by your side on difficult days, having people on your side can make a huge difference. Number 2, create a safety plan. A safety plan is a plan that you create ahead of time to utilize in moments of high distress or when you start having more suicidal thoughts. Again, I have made one that you can download and fill out on your own. It's linked in the description box below. So after you finish watching this video, make sure you click on that to download your free copy. One important thing that you can do is to give a copy to a safe person, so that way they know how to guide you in case you do call them in a moment of crisis. Number 3, finding coping skills that work and practice them daily. I love to use the workbook called the DBT Skills Workbook. It's one of my favorites for suicidal clients. It has a lot of practical activities and tools to help you cope. I have a link to this in my Amazon storefront that I will link below, so check that out. And one of the most important tips I can give you is to practice coping skills daily, especially when you're feeling really good. One of the biggest mistakes people make is waiting to practice or use coping skills until there is a crisis. This is not helpful because your brain starts associating the coping skill with the bad feelings, and our brain can't try something new when it's in crisis. But if we practice daily and it becomes part of our daily routine, our brain is much more likely to access the coping skills in times of crisis and benefit from it. So set aside 5 to 10 minutes a day to practice coping. And finally, seek professional help. I cannot emphasize this enough. If you have access to therapy, don't delay. Check your insurance provider and get a list of in-network providers, or you can check out the reduced price directories like Open Path Collective, where therapists post reduced priced rates. I have a list of other directories and crisis resources in the description and a lot of helpful links. So again, please check that out, save this video, and save the links for future reference. I am so happy that our nation has finally provided a mental health emergency line. You can now call 988 if you reside in the USA, and you will have access to a crisis center 24 hours a day, 7 days a week. It's available to anyone in suicidal crisis or emotional distress. I know that this video was heavy and filled with a lot of information, so if you have any questions or concerns or you want me to elaborate on other topics, please leave them in the comments below. Let me know what questions you have about suicide. What are you afraid will happen if you talk to a friend about their suicidal ideation? What are you afraid will happen if you share your suicidal ideation with a friend? Maybe we can support each other in the comments, and I can use some of your questions to make future videos on this topic. And this is not an easy topic. It's not light. Make sure to take care of yourself after watching this video. Take a few moments to take it all in, take some deep breaths, and check out the resources below. If you enjoyed this video or found it beneficial, please give me a thumbs up. Subscribe to my channel if you haven't already done so, and I will see you in the next video.